Today, we're talking about Vienva, a combination hormone medication used to prevent pregnancy. It contains two hormones, a progestin and an estrogen. In addition to preventing pregnancy, Vienva can also make your periods more regular, decrease blood loss and painful periods, decrease your risk of ovarian cysts, and treat acne. It's important to note that using this medication does not protect you or your partner against sexually transmitted diseases such as HIV, gonorrhea, and chlamydia. For optimal effectiveness, Vienva should be taken at the same time every day. It's important to follow your doctor's instructions and take the medication as directed. Before starting to take Vienva, make sure to read the patient information leaflet provided by your pharmacist. It contains important information on when to take your pills and what to do if you miss a dose. Take this medication by mouth as directed by your doctor, usually once daily at the same time each day. If you are taking the chewable tablet, follow the manufacturer's directions for your brand. It's important to take this medication exactly as prescribed to prevent pregnancy. Vomiting or diarrhea can affect the effectiveness of the medication, so use a backup birth control method if you experience these symptoms. You can take this medication after your evening meal or at bedtime to help with stomach upset or nausea. Your pill pack contains 21 pills with active medication and may also contain 7 reminder pills with no medication. You should have your period during the 4th week of the cycle, and if you do not get your period, consult your doctor. If this is your first time using this medication and you are not switching from another form of hormonal birth control, take the first tablet on the first Sunday following the beginning of your menstrual period or on the first day of your period. Use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy until the medication has enough time to work. If you need to switch from other forms of hormonal birth control to Vienva, consult the patient information leaflet, your doctor, or pharmacist. Some common side effects of Vienva include nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, or weight change. You may also experience vaginal bleeding between periods or missed/irregular periods, especially during the first few months of use. If any of these effects last or get worse, it's important to contact your doctor or pharmacist promptly. This medication may raise your blood pressure, so it's important to check it regularly and inform your doctor if the results are high. Serious side effects may include lumps in the breast, mental/mood changes, severe stomach/abdominal pain, unusual changes in vaginal bleeding, dark urine, or yellowing of the eyes/skin. Vienva may also rarely cause serious problems from blood clots, such as deep vein thrombosis, heart attack, pulmonary embolism, or stroke. If you experience symptoms such as chest/jaw/left arm pain, confusion, sudden dizziness/fainting, or trouble speaking, seek medical help immediately. While a serious allergic reaction to this drug is rare, it's important to get medical help right away if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, contact your doctor or pharmacist. If you are over 35 years old and smoke cigarettes, do not use Vienva. Smoking while using this medication can increase your risk of serious health problems such as stroke, heart attack, blood clots, and high blood pressure. This risk becomes higher as you get older and smoke more cigarettes. It is important to avoid smoking or using tobacco while taking Vienva. Before taking Vienva, it is important to inform your doctor or pharmacist about any allergies you may have to estrogens or progestins. Also, discuss your medical history, including any blood clotting disorders, high blood pressure, cancer, diabetes, liver or kidney disease, and any recent or upcoming surgeries. If you have diabetes, it's important to monitor your blood sugar regularly and notify your doctor of any changes. Additionally, if you have phenylketonuria, PKU, or diabetes, be cautious when taking chewable tablets that may contain sugar or aspartame. If you are planning to have surgery or will be confined to a bed or chair for an extended period, talk to your doctor about any necessary precautions with taking Vienva. It's important to limit your sun exposure and use sunscreen while taking this medication, as it may cause dark areas to appear on your skin. Additionally, if you are nearsighted or wear contact lenses, you may experience vision problems, so contact your eye doctor if needed. After stopping Vienva, it may take longer to become pregnant, so it's best to consult with your doctor if you're planning to conceive. This medication should not be used during pregnancy, and if you become pregnant while taking Vienva, notify your doctor immediately. It's also important to discuss with your doctor if you are breastfeeding, as Vienva may decrease breast milk production and have undesirable effects on nursing infants. When taking Vienva, it's important to be aware of potential drug interactions that could affect how well your medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. There are several products that may interact with Vienva, including aromatase inhibitors, fezolinetant, aspemifene, tamoxifen, tizanidine, tranexamic acid, and certain combination products used to treat chronic hepatitis C. Some drugs may also cause hormonal birth control to be less effective, potentially leading to pregnancy. These drugs include griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, drugs used to treat seizures, and HIV drugs. If you start any new drug, be sure to tell your doctor and discuss if you should use additional reliable birth control. Also, notify your doctor if you experience any new spotting or breakthrough bleeding, as these could be signs that your birth control is not working well. It's also important to be aware that Vienva may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are taking this medication. If you or someone you know has taken too much Vienva and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or the local poison control center. Symptoms of overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. It is important not to share Vienva with others. While taking Vienva, it is important to have regular complete physical exams, which may include lab and/or medical tests such as blood pressure, breast exam, pelvic exam, and pap smear. Follow your doctor's instructions for examining your breasts, and report any lumps right away. It is important to keep all medical and lab appointments. Be sure to consult your doctor for more details. If you miss a dose, refer to the product package information for advice on what to do. You may need to use backup birth control, such as condoms or spermicide, to prevent pregnancy. If you often forget to take your pills as directed, contact your doctor to discuss switching to another form of birth control. When storing Vienva, make sure to keep it at room temperature and away from light and moisture. It's important to store it in a safe place, away from the reach of children and pets. When it expires or is no longer needed, don't flush it down the toilet or pour it into a drain. Instead, consult your pharmacist or local waste disposal company for proper disposal. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.